Hello everyone, welcome back to our channel. Are you feeling overwhelmed by OET listening part A? You are not alone. Many candidates struggle with this section, but with the right strategies, you can turn into your strongest skill. So stick around because in this video, I'm going to break down everything you need to know to master this task. So let's get started. When it comes to OET listening, Part A task is very vital for healthcare professionals. It is designed to test your ability to extract specific information from real life medical consultation. So, this is an important skill you will need every day in your profession. By the end of this video, you will know exactly what to expect, the key skills required, and practical strategies to boost your score. Okay, so when it comes to the structure of part A, here you will listen to two recorded healthcare consultation. So each will last around for 5 minutes, and your task is to complete the healthcare professional's notes based on the information that you hear. There will be 12 questions to answer, which will follow the flow of the conversation. So here are some key points to remember. Remember, the audio plays only once. So active listening is very crucial, and your answers must be accurate, clear, and concise. You will be filling the gaps in the notes. So listen for keywords, medical terms, and specific details. Now, what are the key skills required in order to get more score? In order to succeed in this task, you need the essential skills as follows. The first one, as I told you, active listening. That's pretty important. So try to train your ears to catch important details like symptoms or medications, dosages, and timelines. The next one is note taking skills. Try to develop shorthand techniques to capture information quickly without wasting time in writing it fully. Because note taking, you need to do it very fast, right? So try with this strategy. The next one is the speaker's words might differ from the wording in the notes. So try to identify the synonyms and rephrase the ideas, which is the important key when it comes to listening part A. The last one is predictive skills. Now try to use your time, reading time especially, to predict possible answers, which will help you focus better during the audio. So when it comes to pre-listening strategies, here what you need to do before the audio starts matters the most. You will have around 30 seconds before the audio starts. So try to use this time wisely. Scan the notes. Try to identify keywords like, as I told you, conditions, treatments, medications, and timelines because these clues will help you anticipate what you need to listen for. And try to spot the question types. Some gaps may require one word, and the other gaps they may need phrases. Some may demand specific details like dates or dosages. So you need to spot the question types, what type of question it is, and predict possible answers. For example, if you see symptoms dash, then you need to predict you will hear words like a headache, fever, or dizziness, which is related to the term symptoms, right? So this primes your brain to catch those details. Now let's dive into a detailed example. Listen carefully to the simulated consultation between a healthcare professional and a patient. Afterward, I'll guide you step by step on how to derive the answers. Ready? Okay. Since it's a two-way communication, I'm going to read it for you. Listen carefully. But in the test, you will be hearing an audio. The doctor is greeting the patient. Good morning, Mrs. Adams. What seems to be the problem today? Morning, doctor. I have had this sharp pain in my chest for about 3 weeks now. I see. Is the pain constant or does it come and go? It's not constant. It happens mostly in the evenings after dinner. Any other symptoms? Yes, I have been feeling bloated and often burp a lot after eating. All right, have you noticed any triggers? Well, it seems worse when I eat spicy foods or drink coffee. Okay, are you on any medications? Yes, I've been taking ibuprofen for my back pain, about 400 mg twice a day. That might be contributing to the discomfort. Do you have any other medical condition I should know about? Yes, I have mild hypertension, but I take medication for that too. Amlodipine 5 mg daily. Got it. I would suggest reducing spicy food and coffee intake. Let's switch you to paracetamol instead of ibuprofen for pain relief. Also, try taking an antacid after meals to help manage the bloating. Okay, I'll do that. Now, let's move on to the questions. Here are the questions. Okay, just have a look at it. You can pause the video, read it by yourself. I will also read it for you. Patient Mrs. Adams has had DASH for about 3 weeks. Reports DASH mostly in the evenings. Reports feelings DASH after eating. Possible triggers include DASH and DASH. Medication for back pain. DASH 400 mg twice a day. Has mild hypertension and takes DASH mg daily. Recommended changes: reduce DASH and DASH intake, switch to DASH for pain relief, and take DASH after meals. Each blank refers to specific details mentioned in the conversation. So try to listen for key phrases which signals important information. For example, the doctor asks what seems to be the problem. This leads to identifying the main complaint, right? The patient says, I have had the sharp pain in my chest for about 3 weeks now. So this directly answers question number one, right? So you need to identify the patterns and clues. When the patient mentions it's not constant, it happens mostly in the evenings after dinner, which relates to the question number two about when the pain occurs. And the patient's statement, like I have been feeling bloated and I often burp a lot after eating, this directly answers question number three. And spot connections between symptoms and potential triggers. The patient says that it seems worse when I eat spicy food or drink coffee. So these are the triggers, possible triggers for the fourth question. And you need to listen for the medication details because the patient reveals that I have been taking ibuprofen for my back pain, about 400 mg twice a day. So which answers the question number five, right? Ibuprofen. And the patient's mild hypertension treatment, like I take medication for that, amlodipine 5 mg daily, that fits for question number six. When it comes to question number seven, you need to focus on the doctor's recommendation because the doctor advises, like I would suggest reducing spicy food and coffee intake, which answers question number seven and eight. And for the ninth, also, the doctor mentions try taking antacid after meals. This completes question number nine. Got it? So here is the correct answer that has been written. You can also check with your answers. And that's all for today's video. With practice, focus, and the right strategies, you can excel in the OET listening part A task. If you found these tips helpful, hit the like button and subscribe for more OET tips. And remember, practice makes perfect. Best of luck on your OET journey. Bye bye.